So.
Okay, so what is gout? Let's start there.
In a simple sense, it's just the deposition of uric acid. Basically, it mainly occurs in distal joints, so joints further away from sort of your center of mass, if you will. So it's this deposition of uric acid that essentially precipitates, causes inflammation in the joints. There's an inflammatory response that ultimately leads to some nasty pain, swelling, and a whole host of issues to that specific area.
Okay, so in layman's terms, deposition, you mean like depositing, holding on to?
You think of it as literal as it sounds, as there are little crystals basically and little stones that are sort of left behind in those joints.
And it's in the joints furthest away from center of mass.
Yeah.
So hands and feet.
Yeah. More specifically, you'll see a hallmark look in the knuckles on your hands, and then also on the lower knuckle of your big toe is another big. That's a very common area where you'll see that kind of hallmark look, swelling of a gout attack.
And it's built up uric acid.
It is.
Okay, so what is uric acid?
Uric acid is ultimately produced when the body breaks down purines, or they're just natural substances. They're found in cells and they're found in many foods.
Okay.
So it's a byproduct of that process, again, of breaking down purines. And then our kidneys generally in normal conditions flush out that uric acid with no issue. But, according to, honestly, the Arthritis Foundation talks about this nicely.
Yeah.
And it's more than a waste product. There's obviously some negatives as it accumulates, as we've already said.
Sure.
And then on the flip side, there are some negatives when uric acid gets too low, I suppose. But we'll stay focused on the upper end of that.
Right. So most people don't have any trouble clearing their uric acid out of their body. It's a natural byproduct of eating and processing things. Your body produces some of it. So for most people, that's not an issue at all. But for the people that it is an issue, whether it's because they are producing too much, which could be a function of, you said, genetics,
definitely,
or lifestyle, or they aren't clearing it out properly, which probably would make sense. I guess that could be either lifestyle or genetics as well, or some combination thereof.
Definitely a combination.
Then it builds up, and over time, you said there's like crystals that form inside of joints or something like that?
Exactly.
Wow.
Exactly. And so over time, that can, begin to degenerate and, cause, long-standing issues in a particular joint.
This sounds kind of like kidney stones or gallstones, of the buildup of something that is normally cleared out, but for whatever reason isn't clearing out. And over time, it becomes a substantial issue. Is that a fair assessment?
It is.
Okay. So how is it diagnosed?
So usually you'll have some sort of symptom. Your doctor is not just measuring uric acid typically without a reason to do so. I mean, although uric acid, there's different correlations here as it can be a marker of other chronic inflammatory conditions. So that it certainly has, like we've said, a role in other areas, but your doctor's generally not just measuring that without a reason to do so.
Right.
So gout is symptomatic. So you might have some symptoms. You might, you might have some of the hallmark symptoms, or, the hallmark appearance of swelling in that distal joint sort of the big toe. And then ultimately some blood work will be done, and they'll look at your serum urate or uric acid, and above 7 milligrams per deciliter is generally the cut point of diagnosis, more or less.
Okay.
And then they also will do in a lot of cases, I don't, I'm not the one diagnosing this per se, but they'll also do fine needle aspirations. And so they'll actually look at the fluid in the joint and look for the presence of these, monosodium crystals, they call them. And so they'll look at that. They'll corroborate that with the systemic symptoms that you might have. They'll look at this. They'll look at your serum uric acid level. They might even do some x-rays to look and see what's happened. If this has been went on a long time without you doing anything, there might be some chronic destruction more or less of the joints. Or again, this is certainly an instance where a good rheumatologist can help rule out something more serious. You might want to involve a specialist sooner than later.
So is this one of those things that once you've got gout, you've always got it and your joints are just always in pain at all times? Or does it come and go? Yeah,
good question. It can take any one of those forms.
Okay.
I would say. And that's the thing. If you're actively managing this, which we'll talk about different treatment options,
sure,
you'll certainly find yourself in more of a situation where it's ebbs and flows and you have more, you have 6 months where if things are great, and then you might have an attack, so to speak.
Okay.
But looking at, more specifically at some of the types of gout, there's gouty arthritis. And so again, that's reflective of these acute attacks, and it affects, maybe one main joint, for instance. And then there's tophaceous gout.
Ooh.
And this is more of a waxy buildup of these yellow crystals in the joint. And this takes a long, long time to develop. And so from my understanding, maybe, you're not having attacks all the time, but there's this, if again, you haven't had your uric acid measured, not many people don't need to, you haven't had overt pain, maybe you just think it's arthritis. And then sure enough, it amasses to this serious, difficult to treat issue.
Okay.
So, those are the general types.
So, I guess, if your family history suggests that gout is an issue, you should be aware of it. But for everybody else, what are the lifestyles that cause this to show up more frequently?
So a big one is obesity.
Okay.
So that's in a lot of cases, very difficult to treat, but that is a large risk factor here for gout. And then also there are some medications and some other conditions that can lend itself to a greater likelihood of gout. And then, so an example of these medications would be certain diuretics. So hydrochlorothiazide is one that it's a commonly used blood pressure medication that oftentimes, can lead to this.
Okay. So if you are on blood pressure meds, like, what'd you say it was?
Hydrochlorothiazide. Yes.
There's a higher chance that you will end up with some sort of gout.
Potentially.
Side effect.
I think if you've never had a gout flare, all of a sudden you are, maybe they look at, it's just natural to look at somebody's med list.
Right.
And also just like you would try to understand a picture of their, everyday diet, if their alcohol consumption, what's their waist circumference, it just would fit right along with that.
Well, and it makes sense too that, somebody on blood pressure medication will also likely, not all the time, obviously, but often have an obesity issue as well.
Mm-hmm.
So that makes sense that they go hand in hand. Anything else in terms of medication that we should keep our eyes open on?
So potentially, and again, not that you would want to stop using that medication per se. It's just, it falls in this, evaluation phase, but diuretics, specifically the one that we mentioned, cyclosporin is another one, niacin.
What are those used for?
Commonly used for, niacin can be used for cholesterol lowering. Cyclosporin is an anti-rejection drug.
Okay. So that's not a lot of people that are going to be facing that one. But
yeah. And then also low dose aspirin would be one that kind of falls into this bucket as well. But these aren't, again, this is not a hard, fast rule to stop these meds if you notice that all of a sudden you have gout.
Yeah. We're talking about the chance that you might experience something is increased by this, but that certainly does not mean that you will.
Mm-hmm.
Okay. So other than the medications, you said obesity. Is there anything else lifestyle wise that people need to be aware of?
Absolutely. So there are certain foods and drinks that, are more than likely to cause someone's serum uric acid to be higher.
Yeah.
So red meat, more specifically organ meats and more gamey meats are the more likely culprits, certain seafoods, shellfish, those are big ones, alcohol, and then also sugary drinks.
Okay. So you're, and again, this is couching all of this very carefully. We are not saying that you shouldn't eat red meat or shellfish or anything like that. It's that those are higher in purines, I assume.
Exactly.
And then therefore your body creates more uric acid as it breaks those down.
Correct.
So you're talking about diets that are very high in those things over a long period of time. They're going to be the ones that are more prone to dealing with gout issues.
Exactly. And it honestly, it seems like the as far as making a stark change, you could say that you're better off limiting organ meats specifically and moving to, a little bit more ground meat instead of the organ meats, and maybe more yogurt or different forms of protein instead of always eating meat. So some sort of stepwise approach to limiting that. If you're even somebody that consumes a diet high in those foods to begin with, it's not like every single person.
Yeah. Organ meat is not a big thing these days, although I have heard a lot about it being very popular in the natural health world, because it is nutrient dense and it has a lot of things in it that you would want and you can get in a concentrated form, but maybe not eating liver every day.
Yep.
Okay. All right.
Yeah. Especially again, if your dad and your grandfather, and there's this history of gout in your family, you're going to have to potentially be a little more vigilant.
And you said sugary drinks. That's the other one. I hadn't heard that before.
So it's oftentimes higher fructose containing foods or drinks. High fructose corn syrup in the form of sodas and
is there any good high fructose corn syrup?
No,
I have not heard associated with anything good ever. So